Actually, we got to talk about this other controversy coming out of New York, though. This one is around AI and healthcare, right? And that because you have a union there claiming that 12 nurses were just laid off to be replaced by AI. And these nurses, they worked at Montefiore Hospital in the Bronx. And apparently on May 28th, they received notices saying they would be let go in 45 days, which would actually be this week. And so that's why this month, you had the New York State Nurses Association sounding the alarm, right? Explaining that many of these nurses, they worked in utilization reviews. So they're the ones reading patient charts and making the case for insurance companies to cover the care doctors request. And one of these nurses, they've been working at the hospital for nearly 40 years. And so you have the association saying that Montefiore is gambling without evidence that AI can do a better job, saying nurses raise concerns about the potential negative impacts on patients, saying if AI replaces nurses' clinical judgment, complicated cases may be dropped, and that means a misdiagnosis or a surgery never gets approved. And you also have the group's president arguing artificial intelligence should never replace real human caring from a nurse. And you've got reports explaining that this kind of nursing, it deals with complicated communications about medicine changes, discharge plans, subjects that they just don't believe AI is equipped to handle. And so you also had local lawmakers condemning these layoffs, accusing the hospital of putting profits over patient care, and adding, these nurses use years of clinical expertise to help patients overcome insurance denials and access the care they need. And adding human compassion and medical judgments cannot simply be replaced by software. And this also comes as earlier this year, nurses across New York, including at Montefiore, went on strike, with AI being one of their top concerns. And so some also believe that these layoffs violate the contract that was reached, as it did say that hospitals had to meet with unions to find ways to avoid job losses due to AI. But as far as the hospital, they're denying any wrongdoing here and saying at the union, they're mischaracterizing the situation, telling the Gothamists, as is often the case, the claims by NYSNA are inaccurate and misleading. What is true is that we are always investing in new technology to ensure the best care and outcomes for our patients, and will continue to do so for the betterment of the people we serve. But also one of the reasons we talk about this is that this issue is not exclusive to nurses in New York. Nurses everywhere, they are dealing with growing frustrations around AI. You had a recent survey finding that the majority of nurses, they just don't believe the technology can be trusted with patient care. And that's very notable because AI use in that profession has exploded in recent years. And you have around half of nurses saying it doesn't even save them time. And 83% say that the AI output is rarely accurate enough to use without needing to be checked first. And it also doesn't stop there. You've also got Mayo Clinic. They're getting sued for allegedly using AI to cut corners on patient care. And you got that lawsuit coming from a former employee who was the research director overseeing AI compliance. And she claims that she was retaliated against and fired for accusing the hospital of rushing to incorporate AI into its operations. And Minnesota Public Radio, they were the first to report on this lawsuit, which claims that Mayo Clinic's AI Compass, it prioritized speed over accuracy and manipulated data. Right, but one of the biggest things here is that even with this backlash, that doesn't mean that AI is going anywhere anytime soon. According to reports, healthcare AI spending, it reached $1.4 billion last year, which is nearly triple what was spent in 2024. And while AI has shown major promise, right? Many studies have found AI to be useful in early detection for cancer and other diseases. Last month, you had the Washington Post doing a big report noting that one of the reasons you might see AI in the doctor's office more often, it actually has to do with the Trump administration. Right? Amy Gleason, who previously led DOGE, has apparently been tasked with bringing AI into our health systems as an advisor to RFK Jr. And you also had the administration already backing a controversial pilot program that allows AI chatbots to refill prescriptions in Utah. And officials are also planning to offer millions of dollars in research awards to developers of an AI cardiovascular care software. And you're seeing people saying essentially that it feels like the administration is trying to build the railroad, but the train's already left the station. Or with, for example, the Post noting in internal discussions, some in the administration are working on a way to regulate independent AI doctors.